Good afternoon, everybody. It is an absolute honor and pleasure to be here with you all today. I have entitled my presentation for today, All Hands on Deck, the need for multidisciplinary scientific efforts to create healthier environments. So this is a list of the top 10 leading causes of death. And as a society, our scientists, our policymakers, our community at large, we're all working to try to reduce the public health impact of these diseases. And when we think about what health means fundamentally, it's about your body's ability to operate at an optimal level, to make sure your heart keeps pumping as it's supposed to pump, to make sure your eyes are perceiving the world around you, to make sure your neurons are firing appropriately. But when we look at these top leading causes of death, we have substantial scientific evidence that the environment is affecting our risk of disease. So somehow, our human body is being affected by the environment in which it exists. So if we want to reduce the impact of these leading causes of death, then it makes logical sense that we need to think about the environments in which our bodies exist. And when I say the word environment, I mean it pretty broadly defined in the traditional sense when we talk about air quality, water quality, but also in our physical and social environment. So how walkable is your neighborhood? Do you have access to healthy food? Do your neighbors get along? All of these factors are associated with health outcomes. And then the question of how does this environment get under the skin, is one of the parts of eco-social theory. So it says a central focus is how we literally biologically embody exposures arising from our societal and ecologic context. At issue are socially patterned exposure-induced pathogenic pathways mediated by physiology, behavior, and gene expression that affect the development, growth, regulation, and death of our body's biological systems, organs, and cells, culminating in disease, disability, and death. And one of the areas of my own work is trying to understand how environment affects health via gene expression. So we used to think about genes as on-off switches, that you have certain variants, you make the gene or the product of the gene. But more recently, we've started to think about epigenetic modifications. And epigenetic modifications act as somewhat, rather than thinking of it as an on-off switch, we're realizing that there's dimmer switches that can control how much or how little of a gene that you're making, with DNA methylation being the most studied of these. And what we know is that environmental factors can affect these epigenetic modifications, which in turn can affect the biological dysfunction and then disease itself. And this just highlights one of the mechanisms through which the environment can affect how your body's functioning and thereby overall health. Now, if we look back at this top 10 leading causes of death that we know that has a lot of environmental factors, what we also know from the literature is that these diseases also have substantial racial and ethnic health inequities. So if we know that it's really about the environment that are causing these racial health inequities. So David Williams from Harvard, he argues that racial residential segregation is actually a fundamental cause of racial health disparities. That if you geographically separate people by races and then allocate resources into some neighborhoods and then not to others, that's the reason that we see these long-standing, persistent differences in disease outcomes for all of these different diseases that have very high disease burden. This was tested in the Exploring Health Disparities and Integrated Community study, which was led by Thomas Levis, who's the Dean of School of Public Health at Tulane University. He did this work when he was at Hopkins in Baltimore. And he wanted to understand, well, what happens if you he was specifically looking at black people and white people, if you put black people and white people in the same environments, black and white people who have approximately the same SES, do you still see these same statistics that every other research study is finding? And what he found is that under the condition in which black people and white people lived in the same community with the same SES, that you either saw a very strong attenuation or an elimination of these disparities that the literature has so long demonstrated. And what do we know? We know that this isn't by happenstance, that racial residential segregation didn't just happen, that it's not a natural phenomenon, but really it's the result of policies in our society that have caused this separation of race. and most notably being redlining. So I'm showing here a map of DC, which is the area where I'm from. And in the 1930s, the Federal Housing Administration had these maps, and they would use these maps to grade neighborhoods, and then based on the scoring of those neighborhoods, decide where and where they would not insure mortgages. So just taking the language from that, for DC, a grade A neighborhood was considered the best residential area and are occupied chiefly by persons in the highest income groups, where they said grade H neighborhoods are more the result of exploitation of the Negro rather than a planned development. And then they wouldn't fund mortgages or wouldn't insure mortgages in the H neighborhoods. And in this way, federal policies maintained or exacerbated racial residential segregation. So here, taking, again, a quote from the FHA manual from 1930, it said, and this was used to guide underwriters to decide whether or not they would insure the mortgage. They said, if a neighborhood is to retain stability, it is necessary that property shall continue to be occupied by the same social and racial classes, that in communities where there is any possibility of Negro infiltration, the application for the insurance should be rejected. Unsurprisingly, then less than 2% of the approximately $120 billion of housing financed by the Federal Housing Administration and Veterans Administration between 1934, which is the wake of the New Deal, and 1962, which is the Civil Rights era, went to non-white residents. And then if we look more contemporarily, using data from that same edict study that I mentioned earlier, only 0.6% of US Census tracts are currently racially and socioeconomically integrated. Now, why am I talking about something from the 1930s? Because the legacy of redlining continues. So recently, scholars have started to look at contemporary health outcomes and compare them to these redlining maps from the 1930s. So looking at these redlining maps from the 1930s, that now in those areas that were considered the less desirable neighborhoods then, we still see low birth weight babies being born, more ER visits due to asthma and heat, later cancer stage diagnosis. In my own work, looked at COVID vaccinations in the early stages of the pandemic or in the early stages of it being administered when it was in short supply. So we still see the legacy of these redlining practices. And if we look specifically at the environment, this study did a nationwide analysis looking at environmental factors, specifically looking at air pollution, noise pollution, light pollution, and then vegetation and greenness. And looking at air pollution, when they looked at NO2 and particulate matter 2.5, these maps mostly went from A to D, where A was the most desirable neighborhood and D was the least desirable neighborhood. You still see the effects now of current levels of air pollution. And we see the same kind of trend when we look at light pollution, noise pollution, and then the inverse for vegetation, that we see this graded response depending upon the redlining score from the 1930s, and we still see these environmental factors having an effect today. Which then brings us to the title of this panel today, Environmental Justice. And what does that even mean? Well, as defined by the Environmental Protection Agency, environmental justice means the just treatment and meaningful involvement of all people, regardless of income, race, color, national origin, tribal affiliation, or disability, in agency decision-making and other federal activities that affect human health and the environment, so that people are fully protected from disproportionate and adverse human health and environmental effects, including risks and hazards, including those related to climate change, the cumulative impacts of environmental and other burdens, and the legacy of racism or other structural or systemic barriers, and have equitable access to a healthy, sustainable, and resilient environment in which to live, play, work, learn, grow, worship, and engage in cultural and subsistence practices. Now, the environmental justice movement was initiated by communities of color who recognized that their neighborhoods were being disproportionately affected by pollution. Matter of fact, its origins can be traced back to civil rights era, that when Martin Luther King was assassinated on April 4th, 1968, it was in Memphis, Tennessee. And what was going on in Memphis, Tennessee that time? It was the Memphis sanitation workers strike. And the strike gave attention to the inequalities regarding the pollution in the African American dominated communities due to the placement of waste facilities. And then this has been followed by a string of events over time. In 1979, there was a fight in Houston, Texas, to keep the Whispering Pines sanitary landfill from being placed within 1,500 feet of a public school. And the residents came together to file a class action suit that charged environmental discrimination. Unfortunately, they didn't win the lawsuit, and the landfill was still built. A couple years later, in 1982, African Americans organized a nonviolent sit-in protest against the landfill in Warren County, North Carolina. Over 500 people were arrested, but the protest also was unsuccessful in halting construction. In April 1983, the Solid Waste Sites and the Houston Black Community Study was published. Dr. Robert Bullard, who was actually the husband to Linda Bullard, who was the attorney in the 1979 case, conducted a first-of-its-kind study documenting the location of municipal waste disposal facilities in Houston. And he and his colleagues found that there was a high concentration of toxic waste sites in African-American neighborhoods in Houston, that all 5 city-owned garbage dumps, 80% of city-owned garbage incinerators, and 75% of privately owned landfills were situated in Black neighborhoods, despite African Americans only making up 25% of the population in Houston at the time. A couple months later in the same year, in June 1983, prompted by the 1982 Warren County sit-in, the United States General Accounting Office published a study that found that 3 out of 4 hazardous waste landfills examined were located in communities where African Americans made up at least 26% of the population and whose families' incomes were below the poverty level. So these studies started to provide the empirical support for environmental racism, which obviously those who lived in the neighborhood already knew was happening. In 1987, the United Church of Christ Commission on Racial Justice examined the statistical relationship between the location of a hazardous waste site and the racial and socioeconomic composition of host communities nationwide. The study found that over 15 million African Americans, 8 million Hispanics, and half of all Asian, Pacific Islanders, and Native Americans resided in communities with at least one abandoned or uncontrolled toxic waste site. And this study furthered the conversation because it addressed the issues of race, class, and the environment on a national level. The study noted that although the socioeconomic status of residents appeared to play an important role in the location of hazardous waste sites, that the residents' race was actually the most significant factor amongst the variables analyzed. 20 years later, in 2007, a follow-up study was conducted and concluded that people of color are found to be more concentrated around hazardous waste facilities than previously even shown in the 1987 study. So we see a persistence of this issue going on. So the quest for environmental justice continues. The Justice 40 initiative from the White House is intended to address some of these issues by setting a goal that 40% of the overall benefits of certain federal climate, clean energy, affordable and sustainable housing, and other investments flow into disadvantaged communities. And obviously, we still have the issue, the ongoing and increasing issue of dealing with climate change, and we do have a significant effort going towards that as well. And this timeline of events, it wasn't meant, obviously, to be a comprehensive list, but it shows the synchronized efforts of what happens when of community coming together, researchers using their tools of privilege and expertise, as well as policymakers to address an issue such as environmental justice. So what I want to leave with is the idea that environmental justice is the responsibility of all of us, despite your scientific background or even your demographic background. And I think as scientists, we should always be conscious of the impact of our work, who's getting the benefits and who's getting harmed either by directly or by inaction as well, and that we center equity in all the work that we do. Hence the title of this presentation, All Hands on Deck. Thank you.